Hello everyone, this is Dr. Hijrat, plastic surgeon, new to HDI family. Today we will ask from the master of hair transplant, Dr. Humayun Mohmand, about creation of sites. Can you please tell us about how you create sites and what makes it more special and different from others?
Okay, when you're making the sites, that basically means you are creating a space for the graph that you have taken either with an FUE or in strip method, and then sort of making those follicular unit graphs. So one way or another way you are measuring that. So this is a blade handle that myself and Dr. Ahmed from my clinic as well, we have designed together, and it can hold this cut to size blade. Now these blades are different than other blades. These are, if you see closely, it has got beveled edge. The edge is beveled, and the reason for this beveled at a 40 degrees angle is that when I'm making a site, the site is of the same 1.2 or 1.1 millimeters length that I make. If I have a straighter one, I'll make 1.4 millimeter length for every 1 millimeter. So right, it's about 40% longer. So with these angle, we can totally avoid that thing, right? And I don't believe in what we call its coronal angle, because you can see there are two things in creating the sites. One is the direction and other is the angle, right? The angle is this is the angle. Now this angle with the skin is the angle of the exit of the hair. Direction is which direction the hair will grow. So as I go towards the temporal fringe, my angle keeps on getting towards the outer side. You can see these angles are changing, and as I go towards the middle part, my angle is coming towards the middle, towards the center. So this is how I keep on changing the angle, sorry, the direction. And my angle in the first, see how his hair in this area is angled like this, the way I was creating. And if I see the hair on the back, it is slightly bit more like obtuse angle. It is more towards 90-degree than over here, which is more towards 15 or 20 or 25 or 30 degrees, something like that, usually about 15 degrees or 20 degrees. So that means, so what people make a mistake in creating a naturalness is they start, because this is the angle, so they transfer this angle over here. So the forehead and the hair, there is a very obvious inclination of the hair, which is more obtuse. So that gives a more hardness to when you are looking to the hairline. So that is why we are mashallah, well known for creation of a natural looking hairline. And then people talk about irregular hairline, and this hairline and that hairline. Now one of the people that I've always followed is Dr. Ron Shapiro. He talks about two things or three things. He talks about macro irregularity, a micro irregularity, and apart from micro irregularity, there is a third thing which people do not understand, and he does mention, but he has probably not given a lot of stress on that, on those ones. They are called centennial hair. Now if you see, this is the macro, so there is a arch over here, then there is an arch over here. These are macro irregularities. And if you come close to this, you will see this is a triangle of a hair which is going like a triangle, right? And then there is a triangle over here, right? And so this is micro irregularity, and in between we are giving these centennial hair, which will, because even if it is if I'm going, let me just show you, right? Okay, I'm just going to show you why I'm just going to create the micro irregularity only, okay, along with the macro irregularity. But I'll show you something which is very unique and people do not see that. Now look at this. I've created 3 micro irregularities, right? And let me just make one more so that I can show you a little bit more of that. Right here, this is the 4th micro irregularity on a macro irregularity. Right now, if you see, your hairline is going like this, coming out like this, going out like this, coming out like this, going out like this, coming down like this, going like. So in this thing, I can trace a line. So that means this micro irregularity has a regular pattern or irregular pattern, but a line can trace its outline. So that is why it will still look unnatural when the hair will grow. So that is where you put every now and then you can use these these centennial hairs and break those micro irregularities. So this is how what makes us very different than the rest of the world. I'm sure there are other ways of doing it. I'm not saying that I'm doing this best thing, but I'm certainly one of the doctors whose patient love him for the naturalness that I create. I mean, this gentleman who apparently has done a great research has been to a lot of doctors, and one of my interviews on the television, I said that most of my patients say that, or I tell them that, look, people will tell you that you are thinning out, so why don't you have a hair transplant done? Now, he actually met one of my patients who said exactly the same thing. He told him that, look, I've had this hair transplant done and it is so natural that people tell me that you have just thinning out, so why don't you have a hair transplant done? Now, that is what I say. A good cosmetic surgery is seen by everyone but recognized by none. So that is how we do it. But your depth, your angle, your direction of the hair are paramount. Your depth should be deep enough that these follicles stay in there. It should not be deep enough that you damage the underlying vascular sort of supply. You must remember the scalp has got centripetal vascular supply, so that means there are no perforators. So if I damage a vessel over here, 6 vessels on the periphery, I can actually necrose the whole of the scalp. So as much as the scalp has a great blood supply, it is still dangerous, because I can technically, with my FUE and FUT, I can technically damage all the vessels at the periphery, and I can create a necrosis in the middle. I'm sure you must have seen that one of a television star had this complication. He only had 2700 grafts, so that was not big deal. But what the surgeon failed to understand, he went too deep on the sides, in the front. So his supraorbital, superficial temporal, posterior auricular, these arteries, which are the main supply of arteries, were severed. And because he was doing an FUE, probably his posterior occipital arteries were also damaged. So he had a huge necrosis in the middle of the forehead. So, middle of the head. So you need to understand all those things. So all these things stay in your mind subconsciously while you are doing this. So that is what we do and how we do it.
Thank you so much, sir. Thank you.
You're welcome.
Hope you enjoyed. Stay tuned for more tips. Thank you.